Hi everyone, my name is Rebecca Van Wollingen. I'm the CEO of Timboon District Healthcare Service. Today I'm bringing you an update regarding coronavirus. I understand there's a lot of panic and confusion out there in the community, and we wanted to give you an update of what's happening here at Timboon and to help you stay informed to keep you safe and calm. So my background is I have a Master's in Communicable Disease Control and Public Health. I have worked for the state before in infectious diseases, and I've worked for international agencies also. I think we're well placed here at Timboon to keep the health organisation safe and to help keep the community calm and to make you take the best actions you can. So currently we've got a coronavirus, which is a group of viruses. This one is a novel one, so it's new to us. It's called COVID-19. It will present with common cold and flu-like symptoms and fever. So if you're experiencing any cold or flu-like symptoms, which include cough, itchy throat, runny nose, headache, fever, ache and fever, make sure you see your doctor or stay at home until you're well. If you do need to go to your doctor, make sure you call ahead. We don't want anyone sitting in the waiting room making other people unwell next to them. Or if you have to present to the hospital, please also call ahead. We will take your call, we'll triage you over the phone, and then we'll put you into a separate room so that we don't run the risk of infecting anyone else. We don't want anyone to panic. Cold and flu season is on its way, so you might just be unwell and it might have nothing to do with the coronavirus. But it's always better to be safe than sorry. So if you are uncertain, please call ahead to either the health service or the GP clinic and be seen by your GP. So the greatest thing you can do to prevent illness is to make sure that you wash your hands, which is a good wash with soap and water. It takes a good minute to 2 minutes to make sure they're clean and there's nothing on them. And or you can use hand gel. You might have some at home, or you might be able to get some at the local shops. If you don't have hand gel, it doesn't matter. Just wash your hands with soap and water. Alternately, or additionally, you also need to make sure that if you have a cough, you cough into your shoulder or your elbow. Don't cough into your hands because you don't want to spread that to everyone else. And if you are genuinely unwell, like you would stay at home. One other measure the government is taking to keep people safe is social distancing. So they're preventing gatherings of large groups, and that's not because they're worried it's going to run rampant and everyone's in trouble. It's to make sure that we have enough distance so the disease doesn't spread between you and me. So if there's 1.5 to 2 meters, it's less likely that we'll catch anything from each other. And if there's less people in the room, it's less likely that we will catch anything from each other. So where you can, stay away from big groups. If you have to be in a group with others, make sure you wash your hands and you show good cough etiquette. If anyone's unwell, make sure that you send them away as quickly as possible and or isolate yourself if you're unwell. So what are we doing here at Timboon? So we've got a pandemic plan for our staff to follow to make sure that we have all the resources and tools and skills we need to keep you safe. We are asking visitors, if you don't need to come, please stay away. If you're unwell, definitely please do not come to the health service, stay away. And unless you're acutely unwell and you need our help, then please either call ahead or present at the urgent care. In relation to all of our services, they are continuing to run at the moment. If there's any change, we'll update you. If anyone is unwell though, please reschedule your appointment till you're feeling better or let us know in advance and we'll give you an isolation room if you still definitely need to have your appointment. In regards to staffing, our staff are well equipped and prepared to give you everything that you need. If you hear anything in the social media or anything like that, please don't be alarmed. The best source of information is the Department of Health's website. We'll put that link here for you. This is the one source of truth. So if you don't know, go here. They have flyers and information. They have it for healthcare professionals and for community members. So it's probably the best place for you to go to get the most relevant and up-to-date information. We are aware that this is a rapidly changing environment, so every day we're getting different information. So I would suggest you go to that website. You can go there every day if you like, and it will tell you the new information every day. So right now the health service is doing everything within our power and as we're advised, and as that changes we'll change our actions and we'll keep you updated. So I guess in summary, the information you need to know is, please, if you feel unwell, stay at home. If you think you need to be seen by a doctor, please call ahead. Make sure you use good hand hygiene and cough etiquette if you're out in public, and stay away from large groups of people. And if you're unwell, don't go near the elderly or the vulnerable. Thank you so much. Please feel free to give the health service a call if you have any questions or concerns.